brain can learn that tinnitus is actually a neutral sound, just like the sound of my breathing going in and out of my nostrils. It's always there, but I never think about it. The brain has helped me by saying, hey, Ben, you don't need to think about that constant sound of breathing. It's just not important. The brain has essentially removed it from my life. So the brain can do these things that are quite fascinating for different sounds. That's what we want to do for tinnitus. Dr. James Hall, so happy to have you here. One thing I love about your contribution to the tinnitus and audiology world is the amount of research you've been involved with and publications. So you're an author. I've literally had textbooks that were written by you. So it's an honor to have you back on the Treble Health podcast. I wanted to ask some questions about sound, hearing, and the cognitive part of tinnitus and help our community understand, in your perspective, what are best practices or what should someone who has tinnitus focus their time on. So welcome to the show. Let's jump into sound and sound therapy. What are the most important things for someone with tinnitus trying to reduce it should know about sound?
Well, first of all, everyone that has bothersome tinnitus should feel encouraged. There's always something that can be done. In fact, most people can reach the point where the tinnitus is just another sound. So always have hope. Speaking of sound therapy means mixing everyday sounds, pleasant sounds, sometimes music, sometimes environmental sounds in with the tinnitus, which the person's always hearing, so that the brain is not just focused on the tinnitus. Sound therapy always should be coupled or be started along with some counseling, which usually is done by the audiologist, but there are many online options for people to seek out some counseling on their own. But the sound therapy is always more effective if the person understands why they have these sounds in the ears, is no longer worried about some of the implications of those sounds, and then is about ready emotionally to just treat these sounds in the ears like any other sound.
Let's talk about that. We'll go with the sound component and then the cognitive or the mental understanding of tinnitus. So, with the sound, what have you found to be successful with your patients for duration of sound, what kind of sound to use, and how to administer it or listen to it?
Sure. And I've had a lot of experience with this dating back to the late 90s when sound therapy was really first introduced and actually studied scientifically.
If you'd like to have a consultation with a specialist who can help your tinnitus and create a personalized plan that gives you a high likelihood of having an effective treatment and result, then I'd like to offer for you to speak with someone at my team, Treble Health. You see, 6 years ago, I started Treble Health and this YouTube community because there was a huge problem for tinnitus. Still today, most people are not getting connected to the right professional who can create a plan to get them help. So I'd like to offer a free telehealth consultation with a member of my team, Treble Health, and you can schedule that consultation by clicking the link right here on the screen or below.
Well, as for the type of sound, it really should be whatever sound the person who has the tinnitus finds relaxing and really enjoyable. So sound should not be thought of as noise. It's noise that has a very bad, connotation. But it should be pleasant. Music is a great option. In fact, there's some great neuroscience research quite recently showing that music has all kinds of therapeutic benefits. But it's very, very good for tinnitus. But for some people, they like nature sounds. Others find just white noise is perfectly adequate. So the type of sound, to answer that question, it's really whatever the person finds most pleasant and most effective. And there, by the way, are apps, of course, with all kinds of sounds. Now, the duration, my advice to people is whenever, during all waking hours, when you're in a quiet place where there isn't a lot of sound, a good example would be, of course, trying to get to sleep at night, and the bedroom should be quiet. But if you're sitting in an office or maybe your comfortable chair at home reading, that's a perfect time to have the sound. So the more the sound is in the background, and it does not have to be loud. We didn't talk about the intensity or the loudness, but it doesn't have to be loud at all. Amazingly, a tiny amount of sound in the background can very often take the brain's emphasis off the tinnitus, and the next thing you know, the person's just reading a book and not even noticing their tinnitus, or they're going to sleep and not noticing the tinnitus. So sound therapy, it's inexpensive. It's low tech, but that doesn't mean it's not effective. So that's always one of my that plus counseling answering questions about tinnitus and misconceptions about tinnitus. That's always my first type of management.
I agree. I tend to communicate to patients that for most people, the two pillars to focus on, two fundamentals, the sound based component and the cognitive based component. And I found with our patients who work with our team, patients get great results when they leverage those two pillars. Let's jump into that second component, the cognitive or the mind, how we think about tinnitus, what we know about it. What does the research show over the years in your own experience? What should people who have tinnitus and are looking for an edge here, what should they learn today with us?
Well, this is really critical, Ben. And the research that I alluded to earlier that really started in the late 1990s focused a lot on this. At that time, the term cognitive behavioral therapy was not usually used in reference to tinnitus, but many of the strategies that people like I were using really had the principles of cognitive behavioral therapy within them. I noticed right from the beginning that if I would talk, I'd see, literally thousands of patients during the year for all kinds of hearing problems, and some would have tinnitus, and they'd talk about it like they were talking about going to a concert or hearing a train go by. It was just another sound. Then another group of people would be really, really bothered by it. And as I started to ask people questions, I realized that some people kind of immediately, it's now the term is mindfulness, but started thinking about the sounds and came to the conclusion that it really weren't any concern. Or perhaps that was after having an audiologic assessment. Other people did tend to focus on the tinnitus sounds, and they became extremely bothersome to them. So, how you approach the sounds, just general counseling, should be directed to help a person put these tinnitus sounds into perspective. And again, dispel any myths or misconceptions the person has about them. But very often, not a lot of times, but maybe a little less than 10% of patients, you may need to get to the next step, which would be a formal way of reordering a person's thinking about the sounds. And cognitive behavioral therapy is one example. It turns out if you Google different management options for tinnitus, there are all kinds of awareness strategies and mindfulness, but they all have one purpose, and that is to remove the negative connotations of the tinnitus sounds and allow the person to begin to just treat them like any other sound. And that couple, you can imagine with that couple with sound therapy can sometimes almost miraculously turn things around.
Absolutely. And guys, if you're listening and you have tinnitus, I really want to highlight this point. If you're a normal person, you're probably looking for a technology, a device, a supplement, something physical that's going to change, put it in your body or use it. It's going to change your health that you're looking for. What research shows, what experts like Dr. Hall and I have found with our patients over years is that do not miss the cognitive side of it. And what does that really mean? Well, I learned from Dr. Jastroboff, one of my close mentors, that the brain can put the sound of tinnitus in the bucket of, oh, this is a potentially dangerous sound. This is an unknown sound. This is maybe something's wrong with my brain. I don't know why this is there. I went to an ENT doctor. They weren't able to give a solution for this. This is going to ruin my life. I'm going to lose my hearing. When the brain goes on those negative paths, suddenly the tinnitus becomes more intrusive, louder, and harder to ignore. Dr. Hall, expand on this. What does our community here need to hear to really illustrate this point of how integral this is? And then we can talk about some things that they can practice. I have some fundamental techniques that are in the CBT, cognitive behavioral therapy toolkit.
Sure. Well, let me just quickly point out that we both had the same mentor, you might say, Dr. Pavel Jastroboff, who, in my opinion, revolutionized the approach to tinnitus. Suddenly provided a way of understanding it, a framework, and I've really relied on that all through the last 30, 35 years. So he always deserves credit, I think, for providing us with the tools that we need. The first step for, in my opinion, for the changing the mind's approach to tinnitus or the person's concept of tinnitus is counseling. And it's not just counseling in a, oh, I want to make you feel better way. It is based on facts. So I think it's important to point out, Ben, that tinnitus is not a disease. It's a symptom. So the first goal always is to find out, is this sound in the person's ears a symptom of something that could be treated by a physician, that could be treated perhaps medically? or surgically. It's natural to want a magic pill or something concrete that you could take it and that's the end of it. But since tinnitus is a symptom, that doesn't really make sense. So we first need to find out what the underlying cause is. Now, the vast majority of people, it's a symptom of some damage or dysfunction in the ear, nothing to worry about. And it's usually either noise or perhaps age related or perhaps some other factor, but it's not any health concern that needs to be dealt with. So the first step is always to make sure that tinnitus is in this category, which is it is for most people, where it's a sound that they're perceiving due to some relatively minor problems in the ear, but nothing they need to worry about.
And I have a colleague who uses the term that tinnitus is a benign body sensation.
Yeah, that's a great phrase to use. Exactly. Benign meaning it's not a concern, it's not pathological in any way. Yep, exactly right.
So it's a non-life threatening body sensation. And when the brain can learn that tinnitus is actually a neutral sound, just like the sound of my breathing going in and out of my nostrils, it's always there, but I never think about it. The brain has helped me by saying, hey, Ben, you don't need to think about that constant sound of breathing. It's just not important. The brain has essentially removed it from my life. So the brain can do these things that are quite fascinating for different sounds. That's what we want to do for tinnitus. However, there are specific techniques and practices that come from either the guided breathing mindfulness world or the cognitive therapy CBT world that people should really know about. Because when you start to practice changing your mind's reaction or response to the sound, specific language you use, how you're hyper focusing on the sound versus letting it be, those small blocks actually build to create something significant. And that's a point that I want to highlight over and over again to the people who have tried 2 or 3 supplements online that do nothing and are not FDA approved. For people who are searching for a cure that might come out in 2030, I'm saying, hold on right now, today, this week, you can learn some techniques that might actually shift this tinnitus a lot more than you think. Dr. Hall, what have you seen with your patients over the years when you were working with a lot of tinnitus treatment cases, when you were using Dr. Jastarov's methods? I mean, what kind of turnaround do you see with your patients?
I'll tell you, man, it's one reason why I so enjoy working with people who have bothersome tinnitus, because I know I can help them. And a turnaround there, I mean, just a quick little story, and this would happen all the time. A person would come into the clinic, they'd be distraught. Grown man would be crying, they'd be worried. The people at the front desk would see all this. I'd take them back and I'd talk to them. I'd conduct a very, very comprehensive audiological assessment, leaving no stone unturned. I'd explain to them where tinnitus comes from, what we knew about management, ask them to ask me questions, I'd answer them. And that person would come out to the same front desk smiling and giving me a hug and shaking my hand. So in terms of turnaround, it can be a matter of minutes. Literally, it's almost like, a switch has gone off. Not always, but very often. And, usually it takes a while for you mentioned for people to begin to realize that tinnitus sounds are just another sound. We all filter out irrelevant sounds, and we need to get the person to do that. It's a natural physiological or natural brain response. We just need to help the person go through that process. So I agree with you 100% that, and I want to emphasize this to those who are listening, that you don't have to wait for some miracle cure. The little things, and I'm going to add one more quick. It's not really little, but other aspect to all of this. In addition to the sound therapy, understanding tinnitus, approaching it with the right, maybe a different attitude and a more positive attitude, or at least neutral. Don't overlook lifestyle factors. Lifestyle factors are not, you know, magical. They're not high tech. I'm talking about a good diet, exercise. If you're smoking, do everything you can to stop smoking. Those 3 factors, poor diet, lack of exercise, and smoking are all big risk factors for tinnitus. And of course, hearing protection, not being around very, very loud, potentially damaging sounds for long periods of time. Those are huge steps. They might be overlooked by many people because they seem so simple, but they should not be overlooked. And those pieced together with what are the other steps that we've talked about are almost all anyone needs to move forward.
And guys, just because something is simple doesn't mean it's easy or it's going to happen
Right.
quickly to turn things around. So these are things that are simple, but They take time, they take some effort. They're not necessarily easy, but they're simple to grasp. And I want to add to that, Dr. Hall, what we see with a lot of our patients, the number one issue patients have coming to us when I say, hey, why is this tinnitus a problem in your life? The number one reason overall, and the data supports this in outside research, is sleep.
I
So
almost
adding
mentioned that sleep hygiene absolutely is
absolutely. So
good.
adding to that lifestyle list that you said, which I completely agree on, what we've found to be really successful for our patients is following a protocol called CBTI, which stands for Cognitive Behavioral Therapy for Insomnia.
Mhm.
That has been shown to be more effective than sleep medications in many patients. And this is studied outside of tinnitus specifically, but the same principles work well for our patients. We'll often just add on or customize some sound therapy to help them sleep at night as well, either with, a sound machine, which I have here on the video, or a sleep headband that has some thin speakers on it. So guys, there are tools out there. Sleep is a piece of it. The other lifestyle factors are a piece of it. Getting your sound therapy system in place and following that protocol. At the end of it, you won't need sound therapy anymore. Having the counseling with a professional who knows their stuff, or a cognitive treatment component, which can help get your mind and your brain in the right place. All of these things make a huge difference. We're now bringing the conversation to the hearing. So many of our patients, we know, Dr. Hall, someone comes in with a tinnitus problem, and I do a full hearing test and comprehensive audiology evaluation, tinnitus evaluation, and I determine, there's actually also a hearing loss. So I'd love to hear your perspective on how you recommend those who have tinnitus with some hearing loss, whether they're aware of the hearing loss or not, what they should do for their treatment.
Sure, that's a critical question. And part of the audiologic assessment obviously will reveal whether there's a hearing loss. If there is a hearing loss, even if it's minor, not a kind of hearing loss that someone might even realize they had, because most adult hearing loss kind of sneaks up on you. It's insidious, it doesn't happen overnight. If there's any degree of hearing loss, that's a perfect entree for using amplification, some type of amplified sound. Now, some people would say, oh, the guy's talking about hearing aids, and I am, but I never use those words when I'm talking with patients because our main focus is not the hearing. I mean, that's a benefit, but the main focus is tinnitus. So I will literally introduce small, very discreet, lightweight hearing aids as tinnitus devices. And sometimes just the sound that's being amplified by the hearing aid. Everyday sounds, the birds chirping, maybe a refrigerator motor, any everyday sound will be just amazing to the person because they haven't heard them. The tinnitus suddenly is pretty boring. It's taken a back seat. So just with a little counseling amplification, it really should be always considered for anyone who has a hearing loss of any type with tinnitus, even though the person's been told perhaps you don't need a hearing aid, and they don't perhaps, but for the tinnitus, it's great. When we're talking about evidence-based or truly effective management strategies, that's amplification is definitely one of them.
Absolutely. It's been studied, it's been repeated that a lot of patients with tinnitus also have some hearing issues. So doctors like Dr. Hall and I, we look at this problem as how can we reduce tinnitus the most for our patients? When we fast forward to when the treatment window is over, what should we do during this treatment to get the best results? For someone who has a high pitch hearing loss with their tinnitus, I'm often having the most success with devices on the ears that are sound therapy devices or they're hearing aids for tinnitus treatment. And a patient would use those daily on the ears during their treatment window. Once their treatment is over, they would not need to use sound therapy for their tinnitus. They may see benefits in the hearing component. So at that point, the same hardware, the same device, the settings can be adjusted and programmed differently so that the patient would still keep the devices but use them in situations they're trying to hear people more clearly, if that ever was a problem for them. So, guys, if you're listening, and it's so common that I hear from you guys, I feel like I've tried everything. There's nothing else that I'm aware that I can do. I need help. The things we're talking about here are so tried and true, proven over research, over expert experience working with patients, best practice protocols. If you speak with people who really know their stuff, they're going to say, before you do anything else, get these fundamentals right and let's track your progress with an evidence-based tool like the Tinnitus Functional Index, where we can measure your tinnitus and see how you're doing over time, there's always options. Dr. Hall, what did I miss here? Let's give our community here more of this actionable, clear, science-based advice. What else should we discuss here on our call?
I'm going to emphasize what you just said, and that is take the first steps first. Don't jump to something that may be even potentially dangerous untested. What we've been discussing here, if you have a hearing, well, first of all, understand these sounds that you have. Make sure you get a complete audiologic assessment from an audiologist to rule out any of the possible causes that could be treated medically or surgically. But most of the time, their ear tinnitus is not going to fall into that category. And these are simple steps. And in fact, that you're talking about the amplification. Now we have what are called over-the-counter devices. Just for the people listening, we're not talking about $10,000 worth of hearing aids. We're talking about relatively inexpensive devices to amplify sound. In my practice, and I'm not a hearing aid expert by any means, but I would always make sure I had some simple open fit hearing aids available just for the counseling. It was amazing. Sometimes people by the end of the counseling said, you've been talking to me, Dr. Hall. We've been talking for the last 45 minutes. I didn't even hear my tinnitus once. And so now they're starting off with a very positive approach. So I would say to the listeners, exploit every simple strategy that we've talked about and give it time. You'd be very, very positively, I think, impressed with the benefits. And then if for some reason the tinnitus is still a concern to you, there we have plenty of options, as we've discussed, such as formal cognitive behavioral therapy.
So, guys, the brain can change. Tinnitus is not set in stone. No matter if you've had this for months, years, feel like you've tried so many things, focus on fundamentals, reach out for help if you need it. There's absolutely help. We're here for you. Dr. Hall, you're a legend. Where can people find your research or your publications if they want to learn more about the work that you've done?
Revamping my website, so I don't have that. But if you Google my name and put the third at the end, James W. Hall III, you'll find a lot of my presentations, certainly some of my articles and books. And before too long, my website will be up and running again. But I'm not the only expert. There are plenty of people out there. I would encourage everyone to be a very critical consumer of what's on the internet, because as I peruse the internet looking for true research, I'm always negatively impressed with how much misinformation is out there, particularly about something like tinnitus. So I've got plenty of resources that people can find. There are books written for patients by audiologists. Dr. Jim Henry, I think you may have spoken to him, has a wonderful book written for the person with tinnitus. And I have no vested interest in the book, but I bought it for my Kindle and it's excellent. So that's a great starting point.
Excellent. We'll link that below. Dr. Hall, thank you so much.
Thank you.
Thanks for watching this amazing podcast with Dr. Hall. Remember that you can click the link on the screen right here if you'd like to schedule a telehealth consultation with a specialist from my team at Treble Health. Thanks, guys. This is Dr. Ben, founder of Treble Health. I'll see you soon.